It's also important for such individuals to have a collaborative care. It means a family doctor and a psychiatrist or a therapist should at least be talking to each other once or twice, just to make sure that, every end is met. As many times what we notice in our practices is that the family doctor has already tried so many different antidepressants, then they come to the psychiatrist, and some psychiatrists will go back and try more antidepressants. A family physician is so frustrated with them because he keeps on coming to their clinics and he keeps on asking for these unnecessary tests that many times the family physician will just hand them a prescription for a Xanax, Ativan, Klonopin, all these sedatives. What happens is that this individual shows tolerance, becomes dependent. Family doctor catches himself in this unhealthy cycle where he finds that, oh my gosh, I've become a supplier of drugs for him. They'll get frustrated and they refer them to a psychiatrist. But by then, this health, illness, anxiety has basically become more like a substance abuse disorder. It has become like a sedative use disorder, a benzodiazepine use disorder. Sometimes a psychiatrist is against prescribing benzodiazepines for them. This can also create disagreements between a psychiatrist and a family doctor, and then the treatment team is kind of split, and that doesn't help a patient and also causes unnecessary stress in a practice. That's why staying educated and informed both as a patient, as a family, and as a provider or as a nurse is extremely important, and getting this person that collaborative care is extremely important. Getting him to a right therapist is extremely important. Educating him about the difference between a real medical condition and a psychiatric emotional condition is important. And also showing empathy and compassion for this individual is very important. And lastly, for such individuals, learning to manage their stress is crucial, and that could be the same thing through exercise, through healthy eating, making sure they're hydrated, have water, they know their stress management techniques, meaning maybe attending a yoga class, maybe attending a retreat, walking, something called forest bathing, like spending time in nature. That is so soothing for your brain, for your body. So they can always go either on a hike with their child, with their wife, with their spouse. That is very soothing for them. Taking frequent breaks, taking some time off, going on a vacation, basically managing their stress will help them to keep their health anxiety disorder in check. Making those healthy social connections is also very important, because when they develop an acute episode of health anxiety disorder, these folks, they're aware, because they're intelligent, they're aware that, my worries are affecting other people. So they will try, not to go to a gathering, and they will isolate, and that isolation further worsens their illness, anxiety, and can lead to depression in severe cases. So it's important that they seek those healthy social connections to people who are non-judgmental and can provide that listening and empathetic ear. Just to summarize it up, health anxiety disorder or illness anxiety disorder, also called hypochondriasis, is a true psychiatric condition. No. A client does not fake it. They don't verbalize these symptoms just because they're attention-seeking. It's a real psychiatric condition, and it's a treatable condition. There is help, there is treatment. Just educate yourself about it, get the right help as a therapist, and in severe cases, see a psychiatrist. The average duration of an episode could last from anywhere from 6 to 8 months. If untreated, however, with proper treatment, you can really shorten the course and lead a happy, healthy life.